people who have autoimmune disease, and they have to be checking their vitamin D at least every 6 months.
Where is conventional medicine still missing the mark when it comes to chronic inflammatory conditions?
We tend, as a physicians, see things separately. Inflammatory disease is everywhere in chronic disease. In chronic states, it starts to alter other systems in the body.
From Red Cross paramedic to physician, neurosciences trainee, and functional medicine expert, Dr. Daniel Cardenas brings a powerful perspective on the mind-body connection, chronic pain, and what real healing can look like.
When someone's in the early antibody stage and they're starting to have symptoms, what are some of the things that you recommend they start doing so that they don't end up in that full tissue damage side? There are people who think it's inevitable. If you have antibodies, it is going to progress no matter what.
It has the opposite effect of helping your body.
We have both seen how often women are told their symptoms are normal when they are clearly not. From your perspective, where is conventional medicine still missing the mark when it comes to chronic inflammatory conditions?
Okay, that's a very nice question. We tend, as a physicians, see things separately. Systems with endocrinology and then cardiometabolic and things that are different. But at the end of the day, when you start looking at all the chronic illness, you realize there's always an inflammatory compound. No matter where it comes, it always something that is the inflammation, getting worse or creating the symptoms that the patient is having. So when you start to looking at with a view, integral view of the disease, you start realizing that inflammatory disease is everywhere in chronic disease, no matter what system. So that is it.
And I appreciate you saying that because it can be really frustrating for patients when they have something like a surgery to treat a condition, or they take one step that their doctor says this is the solution, but yet the inflammation persists. So when we're talking about inflammation, what are we talking about specifically? And how can a patient know when inflammation is a bad thing? Because it's not always a bad thing, but sometimes it's a very bad thing.
Yeah, first of all, we have to understand that inflammation, it's good. It's a system that our body has to defend itself. It's not something bad. The problem is when it's chronic inflammation. For example, when you have a fever or something like that, like an infection, your body reacts with inflammation. It also helps the processes to your body helping to get healthier, to get through the disease. But when you have it in chronic states, it starts to alter other systems in the body, and it has the opposite effect of helping your body. It has the effect of slowing healing. It has the effect also in some parts of the mental state, because when you're talking about inflammation, you're not just talking about the gut or something. When you have a flu, how is your mood? You are or you don't want to do anything. So inflammation, we have to see in all the systems in the body. And I think that's the main thing. Yeah.
If someone's listening to this right now, how can they know they have chronic inflammation? What are some of the common symptoms?
The mood is one of the things that you can see, because I saw a lot of patients and in my clinical experience, they say I have a heavy character. I don't have tolerance for anything. But then you see their habits, they're eating processed food, they're not working, and they have something. Okay, so the mood is very important to realize that you have the inflammation. Also, when you are in an inflamed body, the immune system is not regulated. So imagine that like an army. In inflammation, the army is here, and they're not in a very well formation. So they're very vulnerable to viruses, to catch a flu.
Yeah, I would imagine fatigue too is a big one. And fatigue can sometimes feel like mental fatigue. It can also masquerade as depression. I want to talk about leaky gut. This term gets thrown around a lot, but we know that gut dysfunction can be a major source of inflammation.
Yes.
So often you'll hear conventional doctors say there's no such thing as leaky gut.
Yet
we do have a lot of research. It's funny because they'll say the same thing. There's no such thing as HPA axis dysregulation. There's only Cushing's or Addison's disease. And I'm like, okay, but we've got like a chronic disease epidemic. And you're telling me the only states where cortisol will be off is in extreme disease states. And we wonder why people feel like they're not getting help. But going back to intestinal hyperpermeability, for maybe people who have heard this only for the first time right now, how would you describe that to them?
When you have intestinal permeability, inflammation, for example, is made for you, as we were talking at the beginning, is made for your body to have a better response to illness. So it creates spaces. When you are in an inflammatory state, for example, in a vascular fight, when you have a heat or something, your body reacts in a vascular level to open up and allow like your defenses to go there and fight for you. So when you have chronic states of inflammatory gut, it happens the same. The cells in the intestine, because of the continuous state of inflammation, they start to have a little bit of gaps between them. So those gaps are not meant to be there. So when you eat something like whatever thing you have, it has to pass through the cells, not between the cells. But you have that inflammation, you have that gap, there start to pass some things in those kind of gap that doesn't have to be there. Mm-hmm. So your body doesn't know anything about like it's good or it's bad. It just takes something that doesn't have to be there, and they create defenses against that specific thing. So there's a lot of things that when they start to pass, of course, the body doesn't know, so they react as inflammation. So that inflammation also is going to continue, because every time you eat, it's going to pass something through that gap, and your body is going to respond. And if that kind of things are similar to other tissue in your body, or you start eating like something like a very common thing, and your body's gonna recognize it, it's gonna make defenses against it, and imagine that thing has a little bit similar to other tissue in your body. Mm-hmm. Your body's not gonna know, and they're gonna attack. So it's leaky gut and molecular mimicry. I always make the comparison with rheumatic fever. Like, for example, when you have rheumatic fever because of a bacteria, the body creates defenses against that bacteria, specific ones. And in a molecular way that we call like molecular mimicry, they are pretty much the same of one part of the heart. So the body creates like an army against the bacteria, but then they confuse themselves because it's very similar, like this part of the heart. So they start to attack this part of the heart. So that is molecular mimicry.
So if someone's like, I suspect I have chronic inflammation, what labs should practitioners be running to evaluate that?
Well, you can differentiate like in the basic ones, or you can do like other labs that are more, how can I say, like specialized, like mm-hmm. labs, like for example, when you test fatty acids in the blood and things like that. But going to the basic ones, PSG, like I don't recall how can it is the translation, sedimental globular velocity, like
so like an ESR.
ESR, yeah. Yes. Yeah, so that one is very, very simple to test in a lab, mm-hmm. and you can use it, and it's very good. Other labs that are pretty interesting also, it's for example homocysteine levels. Mm-hmm. It also talks about like inflammation, and there are some levels that the laboratory that are a little bit indirect when you can measure. For example, cortisol. When cortisol is elevated, but you have to test it like in saliva, and maybe 4 points of the cortisol test in saliva, you can see like the patient is in an inflammatory state also. Mm-hmm. Yeah. Mm-hmm.
What are you looking for specifically in that cortisol panel?
You're looking for the response of the HPA axis of the patient. Mm-hmm. So first we have to identify like there are 3 stages of HPA axis dysfunction. The first one is not very evident, and you have to match up the cortisol levels with DHEA sulfate. It's better. So then you can see how the body is reacting to stress. And then you can say, okay, in the phase one, it's when the body is just beginning with the state of stress. There's another phase when it's a little bit more regulated. The body's always trying to have homeostasis, sorry. And the latest stage is when it's like already fatigue and the cortisol may be lower. It's not. That's why it's not very good just to have like the serum cortisol of one test, because it doesn't say you like much about how your patient is reacting to stress. Yeah.
Yeah. And for people listening, we use saliva and we use urine to evaluate the cortisol levels, because 4 points of either spitting or urinating is much easier than 4 blood draws during the day. I would never subject somebody to that. And, going back to the lab testing, the other thing I think is interesting for women to understand is that ferritin can be a marker of inflammation. And so sometimes women are actually iron deficient, but their ferritin is elevated and they think, well, I have a great ferritin, but it's because it's actually attributed to inflammation.
Yes, that's very good.
Yeah. What do you see are some of the biggest offenders for creating that intestinal hyperpermeability in individuals?
It's habits. Like chronic stress, it alters a lot of things. Alcohol. And I also, in my practice, saw a lot of patients that after a surgery, they have the chronic inflammation. So we have to look at things that makes us feel bloated, for example. And it has to be, there's some people, for example, when they eat gluten, they have this kind of reaction. There's people that not. But I think all the things that you feel that overwhelm your gut is going to happen. It's going to be a possible way for having leaky gut.
Yeah. And we also know there's a lot of common medications. So a lot of over-the-counter medications like anti-inflammatories like NSAIDs. Hormonal birth control has been implicated in driving intestinal hyperpermeability, which is specifically the oral contraceptive pill, which I find very troubling because sometimes women are on that for decades.
Yes.
We're going to talk about things you can do to support your gut health. But I before we go there, I want to go a little bit deeper on this molecular mimicry. You had mentioned gluten, and there's this really interesting phenomenon where people tend to have gluten issues in the United States. And yet you'll see people in other countries don't have the rate of non-celiac gluten sensitivity. You practice in Mexico, so I'm curious, do you see people have, a heightened sensitivity to gluten, or what's been your clinical experience?
Well, my clinical experience is, it's something very interesting because I receive a lot of patients that they have all the tests because in physician's mind, when you talk about gluten, you always think about celiac. And they come patients and they told me, I don't have celiac disease. I don't know what happens. I don't have allergy. I can eat a bread and I don't feel nothing. But now I have thyroid problems like Hashimoto. I have burnout. I have a lot of things. So I always start with trying with some patients because and explaining to them that is not an allergy, that is not that you're celiac, it's a sensitivity. And that kind of sensitivity is not always like obvious. I think we have a very useful tool in functional medicine, which is the elimination diet. So sometimes it's a little bit hard for the patient because you get rid of some foods like, for example, gluten, like dairy, eggs. But for them, it's very, very hard for some people to get rid of them. Corn also, imagine in Mexico, like getting rid of corn. Like
That's sacrilegious.
Yeah, you can't do that. Like you just can't do that. But in my clinical practice, what I saw, it's when I take off wheat, I realized like a lot of patients, like maybe, I don't know, not everybody, because it's not for everybody, but 80% of the patients with autoimmune disease, starting from Hashimoto, they get better. And I can see it in the labs. The antibodies go lower. And that's the clinical approach that I have. Like I say, like, it's not for everybody, but it's always good to try it. You don't lose anything.
Yeah. You mentioned elimination diets, and there will be people who are like, I just need to do an elimination diet and my gut will heal. And then it doesn't. What is going on there? What should people know?
Well, the elimination diet is a self-knowledge exercise, and it's not gonna fix like everything. It's just for you to realize which food is not good for you. So after that, you have to make some changes, and there's not easy changes because the food that we're talking about is something that it's everywhere. It's not like some specific things because gluten, it's everywhere. Dairy, it's everywhere. Egg is everywhere. So I told them like it has to be like step to step. After that, you realize like this food is not getting very good for me because you let the time for you to get to realize that. Because sometimes if you just like stop eating, for example, bread for 5 days, it's not gonna be enough for you to realize what's going on with you. And this is also very funny because it happens the same with alcohol. Like a lot of people doesn't realize how much alcohol it's affecting their body and also their mind. So going back to elimination diet, it's very interesting because it's a practice of self-knowledge, and then you have to go step by step. It's a very personal journey that you have to adjust for what your body really needs.
And if you have leaky gut and you've had it long enough, I've seen this when people will do food sensitivity panels, and it's like 96 well food sensitivity, and they're sensitive to 94 foods, and they're like, I can't eat all these foods. I'm like, no. If you have leaky gut, then your immune system is showing us what you're eating every day.
Yes.
And that doesn't mean that everything is a trigger. And it also doesn't mean that these foods have to go away forever. And I think that's always the sign of a good clinician is when they're like, we're going to have a goal of reintroducing and trying to bring things back in.
Yes.
But often we'll see on the internet, people are saying, autoimmune protocol needs to be for life. Low FODMAP needs to be for life. I'm like, no, RIP my life. I love food too much. I would never do it. As someone who's had small intestinal bacterial overgrowth, I'm like, I would not be compliant with that for life. Even like anti-candida diet. And
Yes.
I think the understanding people need to have is that all of these are therapeutic. They are temporary because therapies are temporary only for the time you need them. And what you just described is the program of, basically it's going to have to be tailored for each person, but how you actually heal the gut so you can get back to eating those foods, but also calm the inflammation. I want to ask you though, how often do you see that nervous system dysregulation is actually involved in perpetuating inflammation and leaky gut?
Wow. What a nice question. And I think all the time.
You're like 100%.
Yeah, 100%. Yeah, for sure. Because we live in a sympathetic state. We always are running, we always rushing. And the parasympathetic state, it's where digestion happens. So if we are always like, and I think everybody has fallen that like eating fast because you have to do this and then you have to do another things. So it really it has two things because you are in a sympathetic state. You're not gonna absorb well the nutrients, and also you're not gonna chew well. So those big pieces of food, they're not very well absorbed, and they also create inflammation. So that's in like the physical part. But in the mental part also, let's just remember that our mind and our body is connected. So if we're having a rush always, we always like not having the time, for example, to touch the food. I remember my one of my niece, we were cutting strawberries. And I remember she said like, oh, this is beautiful how it feels to cut the strawberry.
Yeah.
So that connection with food, it's a healing part. It's also a nutrition part. It's not just like swallowing the food. So when you relax, when you have time, or you give yourself the time to reconnect with the food, magic happens. But you have to be relaxed.
Yeah. I appreciate you talking about touching your food. So digestion begins before food ever enters our mouth. There are a lot of parents, my husband's one of them, who will tell my toddler, don't eat with your hands, don't touch your food. And what most people don't realize is that it's necessary often for children to touch the food,
Yes.
starting the digestive process, but it also tells their brain this is what to expect. This is like why it's better that you let a baby feed themselves, not like an infant, but like you let a child feed themselves rather than you giving them spoonfuls,
Yes.
so that they're making that neuronal connection. They're touching the food and the brain is getting the signal what to expect before it ever enters their mouth. And so, and also shout out to every culture that uses their hands to eat food. I see people all the time on social media being like, everyone needs to use silverware, and like, why are you touching food with your hands? And like, it's actually a really good thing to touch your food
really
and to have all of your senses involved. How many times are you telling patients they should be chewing each bite?
I tried. It's hard because it depends on the food, no? It depends.
Yeah.
You can have like some like a gold standard, like you have to. But let's say I say a range of 15 times. Like,
Yeah.
that's the range that I told them. But of course, I tell them if it's something that is softer, you can be a little bit less. But always, I think consciousness when you're eating, it's gives you like the right amount of time that you have to do it, because almost all of the time we don't have our consciousness when we are eating. I don't know if you have tried sometimes just to. I went through. It was like some restaurant make this dynamic. You get in with your closed eyes.
Oh yeah, the blindfolded meals.
Have you
Yes.
tried it? Have you tried it?
I have not tried it. There was, when I lived in Portland, Oregon, there was a place that was doing it, that because at the time I was gluten, dairy, and soy free, I was like, it was like off the table because they're like, we don't do food sensitivities. So I'm like, all right,
Okay.
like
yeah, but it's something amazing, Jolene. Really, for me, it was like I have never done that. It was like 2 years ago, and I realized how disconnect we are when we eat. Really, it has to be like a conscious exercise of okay, I'm getting the taste, I'm getting the textures of the food. Even though it helps you for your digestion, it's a very cool experience to have that.
yeah.
And I think sometimes we put a lot of head and brain about eating, and say, okay, for example, this example of the smoothie is beautiful because you say, okay, I have to eat this one, they have these vitamins, they have this minerals, so you have everything set up, but you forget the process of tasting it, of really enjoying the food.
Yeah.
And I think that part, if you miss that part, it maybe at the end physically the same. You get those nutrients inside you, but if you miss that part, I think you lose a lot of things, because we were talking about like the nervous system regulation, and I think that's where the nervous system regulation helps you to really absorb all your food.
I always joke that people who say food is just fuel, I'm like, those are not my people.
No, not at all.
Doctors say food is not medicine. Yes, hot dogs and hamburgers are not medicine.
medicine.
But if you look at other cultures, it absolutely is medicine. And I will say, in my book that's coming out later this year, I even put in there like tacos is the cure for ADHD, just to kind of push back on that. But I'm like, it makes me really sad when a culture doesn't have that appreciation for food as community, food as joy and passion, and they only view food as just a way to fuel their body. And I think they're missing out on this full experience. But I also think it is a huge reason why we see so many food sensitivities, so many dysregulated nervous systems, is that the act of eating has become a chore, just something that's necessary to do. And, I've talked about tacos, but even if you look at the French, they're like, you eat your dessert, right? You eat these things because life is not just about going through it every single day. It's about slowing down, enjoying it, having the passion and having the joy in it.
Amazing that you said that. And I gonna connect it with I'm from the state of Michoacán in Mexico, so we have a very arranged food culture. So Mexican food, it's human patrimony, but it comes from the food from Michoacán, because we have.
You're like, I'm the original.
Yeah, we are the original. Yeah, and we have a lot of foods, but the interesting part of the food from where I come from, it's as you said, like it's from festivity. You don't always eat the same. You have a specific choice of food. If you're having this kind of festivity, if you're in a funeral, if you're in a birthday, and that's when you connect the food, the kinds of food, with the time that you're living as a human. So it's beautiful if you make that connection. I think it brings you back to life, and you start looking food in a different way.
So I want to ask you, we've been talking about immune system dysregulation. When someone's in the early antibody stage and they're starting to have symptoms, what are some of the things that you recommend they start doing so that they don't end up in that full tissue damage side?
That's a very, very good question. And I always start with vitamin D. It's an immune modulator that everybody should have like good levels of vitamin D. But more patients, as we talked before, about people who have like autoimmune disease in their family, they have to be checking their vitamin D at least every 6 months. So that's the first one, because it's a vitamin, but it works like a hormone. It's everywhere. And one of the things, it's like modulate your immune system. So it's key. It's key for this thing. The other ones is omega-3 fatty acids, also to help you lower inflammation. And in this kind of patients that we're talking about, the elimination diet and things like that, I think patients have to be very aware of the foods that they are eating, because there's not something like everybody reacts different to foods. So as I told with patients with chronic illness, I know sometimes it is very hard to have a chronic illness, because it's something that you sleep and you're gonna know the next day you're gonna have it, and it's something really, it's a burden in your mind. But when you start shifting this chronic inflammation and this disease on, and I said with very empathic thing, not the, what did happen to me, and you start to seeing like more as a path of self-discovery, a journey of self-discovery. It really changed the way you see things. It's not, you're not in the, of course you're gonna be angry because it's not easy to have it, but then you have a thing, you're looking for something, you're looking for, okay, I'm getting to know myself. So going back to the question, I think the key point, if you have a chronic condition, is to get to know yourself. Yes, of course, as I told you, like vitamin D, of course, like the omega-3, there's a lot of things you can also use, like curcumin, like turmeric, and a lot of things. But also like this process of self-discovery, I think is very, very important when you're trying to avoid the progression of autoimmune disease.
There are people who think it's inevitable. Like if you have antibodies, it is going to progress no matter what. I'm curious what you see are some of the causes that drive the escalation of an autoimmune disease. And if you believe it is inevitable that you will have full autoimmunity tissue destruction in every case.
Okay, in my practice, what I saw, it's that you can modulate it. Maybe you just can't get rid of it, like genes, like throwing away and I don't have anything. No, but I think it could be like modulate. And the things that I saw that impacts more in creating more inflammation in the patient, it's not managing well the stress and sleep. I think sleeping right, it's one of the also the key zones of a good approach for somebody who doesn't want the autoimmune disease to prove to get bigger. I think those two things are very, very important also. Yeah.
Yeah, I definitely agree. I mean, sleep is where we repair, and yet there is this cultural mindset of like, we'll sleep when we're dead. Whenever people say that to me, I'm like, well, then you're going to die sooner. That's what will happen. That is unfortunate reality.
That's true.
I'm curious how often you see environmental factors playing a role in this discussion of leaky gut, of autoimmune disease.
When I was in the hospital, like finishing my practices as a doctor, as a physician, of course you don't sleep well. You have like the night shifts, and I see my health. Not just my physical health, also my mental health, like deteriorating, like slower to slower. So yes, it depends a lot on where you work. it also, of course, it impacts in your inflammation and your habits. Yeah.
When we're talking about environmental toxins, what kinds of things do you talk to your patients about?
First of all, avoid the toxins. No, I think is the first thing. I think in the water there could be like a lot of heavy metals and things like that. So you always, as I talk with experts on this, like how to say osmosis, like inverse osmosis.
Yeah, reverse osmosis.
Reverse osmosis. Thank you. I think you have to have first of all a filter of that. Also, there's a lot of toxin that is gonna be. It's normal for we live in that kind of environment, so we have to be aware of it, and we have to the things that we can work on. For example, reduce the intake of alcohol, of sugar, of fructose, to help our liver to clean, to detox. I think that's the first thing that we have to do. Also, for example, that's the classical things, no? But when you talk also about BPA, there's when all the tickets that you get from the store,
Oh yeah, the receipt.
yeah, that the thermic paper, the receipts that you get in all the stores is full with BPA.
Yeah.
That it's a bad toxin for you, for your hormones. So I think we have to get into know what things we can avoid. Of course, smoking is not a good idea because cadmium, that is not acceptable in any ways. So, but I think is that way. I think also we sometimes have a misunderstand the liver, and they sell it like this detox is gonna help your liver to work harder. I think we have to, I don't know how to say, but to pet our liver. We have to
Be gentle with
be
it.
gentle with
Okay.
it. Yeah, it's not because he's lazy. No. It's the liver is not lazy. That's what they told us because of marketing. Because you have to take this pill and your liver is gonna work like that. No, we have to be gentle. First of all, is get to know where we're living. What are the toxins that we're getting in touch with? Like for example, these tickets with the BPA, avoiding the alcohol, the fructose, and then you can have another things like help like silymarin, I think like milk thistle. It will help. But I think the first approach that you have is to be gentle with your liver and reduce the exposure most of you can. Yeah.
When you say fructose, people hear fruit, and they're gonna want to know: are you saying avoid fruit? What are you talking about specifically?
Yeah, no. Fructose is, for example, like box juice. They put a lot of fructose. I think it's the main thing that they use to put sweet, no, on
Yeah, high
things.
fructose corn
Like
syrup.
high fructose corn syrup, and it doesn't. Of course, it sounds like fruit, but fruit has something that is very interesting. Yes, it has, of course, like sugar, but it has fiber. So it's not the same amount of. You can take the same amount of sugar, but in a fruit, when you have the fiber, it helps you like not getting into your bloodstream like so fast. Like for example, if you take it like in a drink with a lot of sugar, with the fiber, it reduces the time that your body is getting into the sugar into your system. So of course you have, if you eat a lot of fruits, it could be, or you have like diabetes or something, you have to be careful, no? But it's not. And yes, it's a very common misunderstanding about fructose and fruit. Yeah, and it's not the same.
You see two ends of the spectrum when it comes to liver detoxification. There's the influencer that says, like, the only way to detox is you have to take all of these supplements. And then there's the doctor that says, your liver just detoxes on its own. There's no reason for you to do anything special. Where does the truth live?
In the middle.
So let's talk about that, because whenever I hear that extreme argument of like, there's nothing you need to do, your liver detoxes on its own, I'm like, and so do your kidneys, but they don't do it without water. Like, there are inputs that are required. There's a reason why we eat. And so let's talk a little bit about how people can nutritionally, lifestyle wise, set up their liver for successful detoxification. And so we've talked a little bit about, like, avoiding alcohol. I think that's definitely number one.
Yeah.
I mean, it's interesting because when you drink alcohol, if you have it with a meal, which is great so you don't absorb so much, but your body actually it'll prioritize processing the alcohol over actually processing your nutrients that are coming in. And of course, that's problematic. But let's talk a little bit about how people can support their liver's detox capacity.
Yeah, so I think first of all, we have to understand like the liver doesn't have like an output. Like it has to go through the kidney, sorry, or through your gut. So first of all, it's not, as we talked at the beginning, it's not isolated. The liver has connection. It has to be, for example, you can have a very good liver, like phase one working perfectly. But if you have constipation, you're not going to eliminate all the things. And it could be even worse because you have intermediate forms, for example, like estrogens. It's going to be there and it's going to be even worse. So I think, first of all, we go back again to the gut. To have a nice working gut, it will help the process of getting rid of the things that you don't need. Also, as you told, like in the kidneys, that's the main thing that sometimes it's not very, because you just go right to the liver. I also saw that they were like selling some castor oil, something that you put
Castor oil packs.
like the packs. Like I personally don't think it works like too much, because you have to know like the liver is not like that. It has a connection with a lot of things, and I think nice gut working, and also like the liver. And going back specifically to how to help your liver to work, there's a lot of things we already talked about, like avoiding toxins. And then we have to understand how it works, the two phases of how it works our liver. So the phase one is the CPY. There's some enzymes that work. And the phase two is the conjugation part. In the phase two, I think we can have more range to work and to help with it. We can use like, for example, this kind of milk thistle, SAMI also, the methionine, it also works very good. But as I say, we have to be very, it depends on every patient. I think that is, yeah.
But I think we could agree, cruciferous vegetables.
Wow, broccoli sprouts, yeah.
Broccoli sprouts especially, because
Yes.
that's going to give you the sulforaphane with the phase two liver detoxification.
Well, yes.
As we're recording this right now, it is Ostera this weekend, which is the first day of spring. And that's whenever, whenever people are like, oh, New Year's resolution, I want to do a detox. I'm like, follow nature's rhythm. When you see the dandelions, that's nature's sign, because dandelion roots help with liver detoxification, and dandelion leaves help with the kidneys detoxifying. And so you can, if you have a yard that's sprayed with glyphosate, do not harvest your dandelions. But if I keep a chemical-free yard, I have dandelions, I let them grow, and before they flower, I take their leaves, I make a tea out of it. I'll dig up the roots, I'll dry them out, and I'll make teas out of that as well. And it's because so many people want to focus on the liver because it is an amazing organ, but you're absolutely right. The process of elimination, the bowels and the kidneys also have to be cared for, and that should be the first step.
Wow, it's amazing what you talk about, like how nature it's speaking to us. Like, wow, that's a very good point that you say about the dandelion. I haven't think about it, but now that you say, like, it's a very, very, very good one.
Yeah. Now we're like, wow, there's kohlrabi and Jerusalem artichoke and kale and chard and all of these things that you're like, wow. And I think that's fantastic. But I also think it's removed us from that rhythm of nature. And of course, I'm not saying like, don't eat a banana because you don't live like in the tropics, but it's more of like just paying attention that like you're in rhythm with the entire earth. Like our health is dependent on the earth's health, and like all animals, we're in rhythm with nature.
Wow, Jolene, it's amazing what you're saying. I always had that idea. That's it. Why New Year's Eve it's on January? Why when it's cold? Why when everybody just want to lay down, hibernate? So that exposed like how as humanity we live like totally separate from the nature's rhythm. Oh, so that's amazing.
Yeah, spring is really the start.
Yes.
It's because it's the rebirth. We're starting anew. I want to shift the conversation into talking more about Hashimoto, since it is like the top autoimmune condition that affects women. We know a huge portion of women here, your TSH is normal, therefore everything's fine. Why is that not correct?
Because it's not like that. We have to understand, as we were talking about before, like everything is connected. So also the thyroid gland is connected also to your mood, is also connected to how you're eating. So TSH, it's a good parameter. We have to look at it in our patients, but it's not the only one. It's not the only one because the thyroid needs a lot of things to work. It's not just like the creating of the hormones. It also, we have to understand that we have when the thyroid gland release the hormone, it's T4. So that is not very active but biologically is almost non-active. It has to lose one iodine, so be active. And in order to happen that, we need minerals, we need nutrients like selenium, like zinc. So if you just look at TSH, it's a good parameter, but it's not going to tell you like everything how it's working, because you have to, as we said, like you have to match the laboratories with your patient. So I think one of the things that we share, Jolene, it's about like not just going to tap the symptom, not to avoid, to get rid of the symptom. You have to take this for a symptom. You have to understand where the symptom is coming. And when you understand this patient with the TSH normal, but they say, I'm tired, I'm losing hair, I have constipation, you have to realize it's not enough just to see TSH. So you have to continue to talk with your patient, habits, how he's sleeping, if they have like the good supplementation, if they're eating a lot of nuts, also seeds. That's why you have to be like an integral view of your patient. But of course, it's important TSH, but it's not the only thing.
There are many women who get diagnosed as hypothyroid. They're told antibodies don't matter, take levothyroxine, so synthetic T4, and yet they don't feel better. What's going on in those cases, and what are doctors missing?
Because the T4, it needs to lose like the deionidase enzyme, which works and make this T4 active in your body. So if you just take the T4, you're gonna have like good levels, but then you're gonna don't have like a good systemic impact, because your body doesn't have the nutrients to make this T4 into T3 to be active. So that's why you just can't just give T4 and stay calm. You have to give T4, see how the patient is eating, see how the patient is feeling, and that's gonna be the proper way that you can realize if it's working, your therapy, or it's not working. You need to do more for him. Yeah.
In the cases of autoimmunity, is it enough just to replace thyroid hormone and do nothing else?
No. It would be like very simple. It would be simple. And in my clinical practice, for example, my recipes for the patients is like 2 pages. And when I see of my colleagues' recipes, it's like levothyroxine 20 minutes before breakfast. That's it.
By recipes, you mean prescriptions?
Yeah,
Okay,
prescription.
I
Yeah,
got
sorry.
you.
Yeah,
I
prescription.
kind of like recipes better, though. Like, here's our recipe to a fantastic life.
Yeah, the prescription. Sorry. So yes, you have to see like all of other things like in the patient, not just like giving the medication. You have to dig in a little bit more.
Can you take us through your framework for approaching Hashimoto's with a patient?
Okay. Yeah, first, what I want to know is how the patient is feeling. For me, that's the right thing, where the first thing that I see in my patient. And after that, you have always to see not just the thyroid gland, because most of the patient with Hashimoto, they're very tired. I think that's one of the main symptoms why they come to me. Of course, then you have bloating and inflammation. Also see like mood swings, and then you start to realize like, okay, it's autoimmune disease, it's Hashimoto, but where does it comes? And again, the first thing that you have to look is the gut. That we were talking about the molecular mimicry and the inflammation. So for me, the first approach is repair the gut, to avoid those stressors that make your body inflamed. So get rid of them. That's the first thing you have to do. After that, of course, you can use levothyroxine, like T4, sorry, and then you have to see how the patient is feeling. Not just like because sometimes in medicine we think it's Jeopardy. No, we're playing Jeopardy, like Hashimoto, like this medication, like this one and this one. No, you have to see where the symptom is coming from. So my approach: first, heal the gut. After that, of course, if you need medication, supplementation, you just do it. But always looking how your patient is feeling, how it's feeling, how their habits, and that's why you make kind of a partnership with your patient in functional medicine, because it's not like you just go and in one consultation you're gonna give them like the answers. And no, it's a process. It's a process. As I always say it, it's a self-knowledge process. Yeah, that's the way I approach it.
How often are you seeing small intestinal bacterial overgrowth or SIBO with your Hashimoto's patients?
SIBO. Well, in my practice, to be honest, a lot of patients that I treat, they don't have like the resources. So to diagnose SIBO, it's a little bit expensive. So sometimes I have that how can I say, like
Barrier.
that? Yeah, that barrier
Yeah.
that doesn't allow me to go deeper in SIBO. That's the truth. Yeah.
Yeah, we have to prioritize those things and be realistic of like, here's our ideal, and then here's what the patient can actually do. And that
Yes.
sounds like that's what you're doing.
Yes, yeah, that's true. Because also with social media, like it's very easy for patient, also for doctors to, okay, I read this and this is the thing that we have to do. But when you see patients, things changes. Like you have to know the status of your patient, like the economic possibilities. Also, there's some cultural barriers that you just have to get to be aware that they exist, and you have to how to modulate your clinical practice also for your patients in each individual case.
Cultural competency is one of the biggest glaring issues, I think, is just non-existent in a lot of medical practices, and that people
Agree.
don't recognize you. You will never have someone's trust if you don't respect their culture. I want to ask about rheumatoid arthritis, because that's another autoimmune condition that you commonly treat. For people who don't know what that is, I feel like Hashimoto is a lot more common, and we've talked about the thyroid, but what is rheumatoid arthritis for people listening?
Well, it's an autoimmune disease, which means your body attacks itself, and it attacks like your joints. It starts like by a process of molecular mimicry. It gets confused, and it attacks your joints, and it's gonna be progressive, degenerative. So that's why it's a very, very debilitating autoimmune disease. What I saw, and it's something that for me is very, very important. This thing that I saw people with arthritis, with RA. There maybe, I don't know how can I say, like 70%, when they came in and I see their faces, because as a doctor, you have to see how your patient getting, how it walks, how it behaves. I saw with this specific autoimmune disease, there are people who want to have control in everything. in mental part, yeah, they try.
With the A-type personality, I
Yeah.
I giggle because literally everybody says this about autoimmunity, but I'm sorry, continue.
Yeah, so that's the first thing. And the other thing is also like their habits. There are people who never sleep well. They have this problem. You don't know what happened first, if they can't sleep and they develop a RI, or it was like vice versa. But there are people who their mental state is always like this. It's always like they're feeling like they're not safe. So this, I think this also accelerates the autoimmune disease, not in a direct way, but in a way that they can't sleep. So if you can't sleep, your inflammation is gonna go up, and also your disease is gonna get worse. But what I try, I also, as I told you, I don't have like a protocol to say you have this disease, you need this. I try to see each patient, but what I see, they have a lot of relief, and it could sound paradoxically, they don't move enough. Because all of the doctors said you can't exercise, you have to don't do anything, and I saw that not moving get the disease worse. And I'm not saying that they have to go and lift heavy weights. No, no, no. But slow, gentle move works marble, sorry, for this kind of patients. Also with the foods, with the also going back to the gut again. I saw when I take off some specific foods that we already talked before, like bread, dairy, those two main. They get better. They get better, but it's a dance for me to treat a patient because they come with a lot of medication. So you have to equilibrate them. Like, okay, I take this food, you're getting better on your inflammation, the joints are less swollen. So let's get a little bit down the medication that you're taking. And then you have to go like step by step. Okay, you start to moving yourself, you start to going to walk 3 times a week, you're feeling better. Okay, let's go down this other medication. Because the average of the patient that I saw with this disease, they have at least 5 medications at least. So then you have, for example, they have like the SSRIs, they have like a lot of things. And then you, for example, of course, if you are in pain, it's going to affect your mood. So then you have some options and you say, look, okay, 5-HTP to get a little bit slower the SSRI. So it's kind of a dance. It's kind of how can I say, like a move with the patient, like have patience with them and ask them to have patience with themselves. And it works marvelous.
Yeah. I'm curious, there's been some compelling evidence showing that oral pathogens and rheumatoid arthritis are connected. How are you integrating that into your clinical approach?
Or like the like oral pathogens, like when, well, I don't have like a specific thing that I do of that. I'm very aware like of that things, and also there's the because we think probiotics. I remember right now a case that she also had like a lot of gum disease,
Gingivitis,
yeah,
yeah.
gingivitis and things like that. So the approach also, these patients have also always a dry mouth also. So what
Do
I
you think there's a concomitant Sjogren's, maybe?
yes, I think almost in every autoimmune disease there's concomitant Sjogren, and these patients because also the specialists agree that when you have a autoimmune disease or process, it's not just one. You have like a little piece of Sjogren, you have a little piece of lupus, you have a lot of things of psoriasis. So for me, and going back to that question, I use two things. Like the probiotics, there's some oral probiotics that works good, but for the people who have this dryness, it maybe sounds like it's something like it doesn't happen anything, but it do, because they have a lot of problems with their teeth. So one of the things that I saw that works marvelous is the coconut oil. A little bit of coconut oil and passing through your teeth.
So like oil pulling?
Yeah.
Okay.
Yeah, like the coconut oil, and it helps you to have more saliva. Also, you have, and going back to the nervous system regulation, these people, when you have a relaxed nervous system, you secrete saliva. And also, as I told you, I saw this character in this kind of patients that are very stressed. They try to control everything, and when they slow down, first they have to recognize it, because you have to be very careful also with this kind of processes. You just can't say like, "Hey, I saw you come and you want control." No, no, no. You have to be very soft with them.
Yeah. I'm like, yeah, that's always like when someone's stressed and then someone says like, just stop stressing. And you're like, that's not the way.
Not the way. Yeah. But when you start to like giving them, for example, for me, one of the things that I said to them, okay, I'm gonna get you 2 things you have to do in your house. When you get a bath, you're gonna feel the hot water on your body. You're just gonna try to be aware how it suits you, how it relaxes you. That's your homework. And the other one is, before going to sleep, you're just gonna have 6 deep breaths to activate the vagus nerve. And with those two things, really, there's some patients that told me like, doctor, this is mind blowing. It doesn't cure me like that, but right now, when I'm in the third breathing in the night, I'm already asleep. And it doesn't happen the first time. They have to do it like continuously. And after, for example, with being aware of the shower, of the hot shower, they say after that, right now, I'm more aware when I'm, for example, at the gym, or I'm more aware when I'm driving. So that small things really makes them like relax the nervous system, and it's also help for the pain and the swollen in these patients. Yeah.
You had mentioned that not exercising actually makes symptoms worse. And I think people automatically will think, well, of course, movement helps and, moving the lymphatic system. But I'm curious in terms of insulin resistance and adipokines, what role you think they're playing in the progression of autoimmunity.
In the progression, yeah, because if we saw the muscle, we have to see it like as an organ. Like myokines also reduce inflammation, also help to regulate the glucose in our body. So, but it's not, if we don't use the muscles, they're not gonna secrete those substances. So I think that's the biochemical explanation of it. But I think in your mental part, when you're moving, you start feeling that you're alive. Movement, it's very connected with being alive. So if they restrict your movement, they say like a lot of physicians tell them you can't exercise. You get disconnected from life, and when you restart moving, it's like an uphill process, because they start walking, then they say, okay, I feel nice walking. Then I go to the water to walk maybe in the pool. And then I start to talk with all the people. And then it comes another thing that is community, that it also works marvel for them. But movement for me, it's basic in these patients. That's a key thing for people with everybody, but more with people with autoimmune disease, who can share their experiences, their pain, what works for them, what doesn't work for them. I think that's, as you said, that's medicine. For me, that's medicine also.
I want to ask about fibromyalgia, because this is something that has a big overlap with autoimmune disease, with gut dysfunction. So let's talk about what are some of the underlying mechanisms you see with fibromyalgia.
Fibromyalgia, I think it's one of my favorite pathologies. And still, there's a lot of people, physicians, that doesn't think it's real. I know it's real. And the thing in fibromyalgia, for me, what I have experienced, and for what I saw in my patients, because we try to think that all the emotions go to our brain, and all the emotions are stored in our brain, but that's not true. All our body, it's how can I say, it's something that is connected. All the emotions is not just here in your mind, it's in all your body. So what I saw with people with fibromyalgia is that they have a lot of things, a lot of pain, mentally things that they can't express, or they don't know how to express it. So the body says it's this accumulative stress of emotions that you don't say, that you keep to yourself, that at the end, your body, the only way it has to tell you something's wrong is about symptoms. And for me, fibromyalgia is that thing. And of course, if you give them like an SSRI, that is going to be like the standard treatment for this, it's not going to heal. It's just going to be a block. It works a little bit, but it's not just the thing that you have to do. For example, my approach with this kind of patients is, okay, I'm going to give you the SSRI for this time, but you have to do something. And specific things that they have to do. And one of the things that I have realized with these patients, it's when I ask them, what do you like to do? Like, do you like the cinema? Do you like to, I don't know, hiking or something? Maybe 95% of my patients, they don't know what they enjoy doing. They don't know. So one of the homeworks that I send to them, the next time that we're gonna see, you're gonna take your SSRIs, but you're gonna bring me a list of 10 things that you really enjoy. So I think that that combination, it works, and it works very, very good. Then I take off the SSRI, uh, and they have already their things that they enjoy. They start having moving, they get better and better. Yes.
What is going on with fibromyalgia? And for people who are not familiar with it, what are the signs and symptoms?
First of all, it's pain. It's pain. It depends on we have like the trigger points that as a physician we know, and we touch them. So in a normal person, you touch, for example, one of them is here. You touch them in a normal person, and nobody's gonna feel pain. You have to do it with your thumbs, and pressure it until it gets like a little bit white. It's a gentle pressure. It's not like this. And you see that the patient, it's hurting me. And so it's that hypersensibility to pain. And when you get some of those points like positive, you diagnose fibromyalgia, because there's not lab test or some x-ray or something that can tell you this is fibromyalgia. And that's why it's a little bit hard to diagnose, and that's why I understand some physicians don't believe in it. So but to resume, like synthesize like everything, it's hypersensibility for pain, to pain.
In your opinion, how much do you think fibromyalgia is central sensitization of the nervous system versus like peripheral inflammation that's going on, or is it both?
I think it's both, but I think it's more peripheral, because we always tend, as we saw in physiology in med school, all the pain is right here. The brain is what tell you, like, but we need to understand that the whole body is connected, and the whole body is always speaking to us. It's not just the brain. We try to mentalize like everything. So yes, of course, it's a part. Maybe will be like some mechanisms in the central nervous system that makes you feel like the pain more, but it's also in the periphery, which means that your body is also telling you something.
What role do you think the mitochondria is playing in this?
Yeah, I think mitochondria plays like almost in every chronic condition.
They're like everything.
Everything, yeah.
Oh.
Yeah, for sure, a lot. Yeah.
Yeah. But, for people listening, as much as they know about the mitochondria, it's probably what they got in 6th grade biology, which is it's the powerhouse of the cell.
Of the cell.
It makes energy. What should people know about mitochondrial dysfunction in the same conversation that we're having about systemic inflammation, chronic inflammation, and then pain amplification?
Well, it's a very nice question, and I think it's very extensive what mitochondria, because it's as you said, like it's a powerhouse of every cell. So going back a little bit with autoimmune disease, you always see, like, of course there's sometimes pain, but you almost always have like no energy. They don't want to do anything. They don't want to go out. They don't want to do anything. So it's a challenge also. It's a challenge because, as I told you, I told them like go and move, but they don't have the energy. So it's a vicious cycle. And when you help the mitochondria, that there's of course you can do like various lab tests and to see the mitochondria and whatever, but like normal things, for example, coenzyme Q10 and things like that that they're gonna help. Almost going back a little bit, remember when I told you like vitamin D, also the omega-3 fatty acids in autoimmune disease, coenzyme Q10 is gonna also work to start supporting the mitochondria. But then you have a lot of things. You can do like sauna, you can do a lot of things to that. But for starting, I think the easiest way to help this kind of patient with fatigue is that. It will be like that supplementation.
Yeah. And going back to what you were saying about exercise, we know that exercise is one of the most effective ways to help modulate the immune system, but also to start to build efficient mitochondria and more mitochondria.
Yes, that's true. Yeah, totally agree. And that's the that's the role we play as a physicians also, because we have to encourage our patients to move. Because if you just say like move and eat vegetables and fruits, it's not going to work. You have to explain them a little bit about, for example, this mitochondria, and this supplement is going to help you to do that. It makes a world of difference if you just take this, take this, take that. It works a lot. Well, I have seen that.
Yeah, I appreciate what you're saying. SSRIs can be life-changing for some women, and then we can work on the other therapies and bring those up so that we can get them off that medication so they're not on it long term. I always say, like, unless the medication is necessary for you to stay alive and avoid chronic disease, like in the case of Hashimoto's, we don't want you developing like heart disease because you didn't have enough thyroid hormone. Like, we need to have a plan to not be on that for life, because nobody wants to have to take a pill every day.
No, nobody. And yes, I think that's the smartest approach to chronic disease. Also, for example, going back a little bit with SSRIs, as sometimes there's a time that we thought that they were like nothing happens. They just bring you joy, and that's it. That's the way they sell to us. But there's not that easy. Everything that changes your chemicals in your brain, you have to be a little bit aware of it. So I use the analogy of a cane. No, when you broke your leg,
No, we've both had knee surgeries. So yeah, we've both been on canes.
we both know what it is.
Yes.
We know what it is. So SSRIs is a cane. When you have like this mood, like going back, you need to know it's gonna help you to get better, to get strong bones, to get back your muscle. And that's what I told to them. Okay, I know you feel with no energy, you're feeling depressed. You're gonna take this SSRI. You're gonna feel the boost, but then you're gonna use it to create a different lifestyle, because eventually you're gonna get rid of it.
Yeah. And we know with SSRIs, there's a lot of people that are like, the research was never great for depression. And I definitely agree. Before they came out, the research wasn't great. But now we're understanding that serotonin is actually playing a role in neuroplasticity and changing the brain. And I think it's important for people to understand where they might be like, wait, you're telling me SSRI and fibromyalgia, chronic pain? Yes, because chronic pain changes your brain.
Yes.
But if we can use something that helps change your brain, like an SSRI, so that you are upregulating neuroplasticity, and then you put the lifestyle factors in place, like that's a way that we can get your body to adapt and to adapt out of the dysfunction that it found itself in. Because as you were saying, it's all about homeostasis, and that's all your body was trying to find. And it became dysfunctional in trying to find that. And so now we have to walk you back out of that. I want to ask you, why do so many patients with fibromyalgia fail the standard interventions that doctors are providing them?
Because it's centered in medication, and there's no, for example, like it would be like saying like depression is a Prozac deficiency. It's not a deficiency of something you have to give to the patient. It's something because a patient, we as people, as humans, we are complex living things. It's not a deficiency of a pill or of a certain thing. Also, with patients with fibromyalgia, I always suggest them to go to a therapist, like a psychological therapy, in order to express the emotions that are trapped in their body. So SSRIs, yes, I use them. I'm not gonna say they're bad because I use them often with this kind of patients. But as I told you, like not a prescription like just take this one and see you in 3 months. It doesn't work. It doesn't work. It will may feel them like a little bit better. But if you encourage your patient and you explain to them what is happening, they feel like your companionship. They feel that they have trust in yourself and in their self, things changes. And that's I think that's the beautiful part that we share about our view, our clinical approach of the patient. It's not just like giving the pill. It's like something different.
You chose to pursue functional medicine. Why is it that you decided to go that route?
Well, it was because a personal medical condition. All my family, my father is infectious disease specialist. I have the aunts that are dermatologists, cousins that are urologists. All my family are like traditional medicine. But then I start to have a lot of some personal health problems, chronic pain, a lot of surgeries, and I was desperate to something to make me feel better, and I wasn't getting all the answers from the traditional medicine. So that thing forced me to look up on something different, and it starts with homeopathy. And I went with this doctor with homeopathy. He treated me. Before that, I thought that homeopathy was just placebo, to be honest. And I, of course, when I was studying, I was maybe sometimes I will laugh about homeopathy. That's the truth. But then I go with this doctor. He treat me. I start feeling better. But I go with him because maybe he was giving me steroids or something that is not good for my health. So I asked him to allow me to see his clinical practice and to understand what is homeopathy. And then
So
when
you thought maybe he was drugging you and not
yes,
telling you?
yes, yeah. No, he was giving me like some medication, like steroids or something that is getting me better,
Yeah.
but it's not good. So I realized, and when I start to understanding the philosophy of medicine, for me was like opening my eyes. Like, wow, this is amazing because you take in consideration the mental things, the emotional things, of course, the physical things. And the basic thing of homeopathy is that you stimulate your body, it works like a vaccine, like stimulates your body to make him like with his own processes, its own process, heal. So then I say, okay, I like this. I start practicing, but you have like your Bible in homeopathy, which is a book that is named Organon. And the first thing that I told you in homeopathy is you need to know nutrition and you need to know your patient habits. Because no matter how good a physician you are and you choose the best medicine, if your patient is doing something that is getting him sick, it's not going to work. And it sounds right now very logical, no? Like, but after I graduated from medicine, it's not logical because the mind that I have in that time, it's a mind that, as I told you, like kind of a jeopardy. Like this medicine, this disease, this medicine, this. I wasn't able to think the way I was looking at medicine right now. So I say, okay, I need to know about nutrition. I need to know about sleep and where do I go? Because I don't know anything about it. In faculty, they didn't show me anything. So I said, okay. I remember I went to Australia to do a pass entry in neuroscience. So somebody talk about functional medicine. Somebody, I just recall that, and I said, okay. I thought it was like something small, but I go to the IFM. I start my certification, and then I realized it was something much bigger than I thought. But that was the path that I followed to get into functional medicine, homeopathy. But still, I very respect the traditional medicine. As we were talking before, we use medications. They're like very helpful like tools that we have. And I think you can integrate like different models. And right now it's working for me, it's working for the patients. Of course, you have to be like because you can lose yourself a little bit. You have to be scientific. You have to see that the things that you're using is working, and also, of course, the safe and the well-being of the patient. If you have those two things, you can see different models without getting lost.
It's always interesting to me because it's usually when people have had a homeopathy experience that they're usually like, maybe there's something more to this. And, as I was saying, when I was in Paris and my son had got sick, you go to the pharmacy and homeopathy is like the first thing they use in France. The pharmacists are like, this is where we need to start. And I think as a science, it's very easy to criticize, but it's something that has always been a gap for me that I can't explain is like, why does it work on animals? And this is something that, my dog, I had a dog that was afraid of fireworks, and I would use homeopathy because what else can you give a dog, right? I don't want to sedate my dog. And it would work every time. And I'm like, okay, like I can see that like there is absence of evidence here. I can hear all the criticisms, but I can't explain this actual piece or why it works on babies because we were like, oh, it's just placebo. But pet doesn't know that I'm getting, and then sometimes I'm like, I'm having to hold her down and put it in her mouth. Like that's not a like positive experience.
Yes,
And yet
it has to be something.
it works. Yeah.
They also use them with plants. Agro homeopathy.
Oh, really?
It's a branch of homeopathy.
Oh, I've never even heard that.
Yes, and it's amazing. One of my cousins is doing that. And yes, of course, I understand why is the resistance of the physicians about homeopathy. I understand it pretty well. But as you said, like I see it like every day how it works with the patients. So really I say, okay, this is working. This is working. Yeah.
I want to ask you just as a final question, in what you see happening online in the wellness space, do you feel like there's oversimplification of what patients are dealing with and that's actually causing harm?
Yes, for sure. And we need to understand it like in an economic perspective, no? For example, for me, it's very funny to see the in the TV, like you have back pain, take the magic pill and everything's gonna solve. But you don't even change the way they sit, the way they move. So I think it's due to selling strategies. I think it's because of that. And before studying medicine, I was 2 years in finance. So that's where I understand. It's not that because some other people can go to the other side and say, like pharma, they're the evil. Of course not. They have very, very interesting things. For example, for me, I got a horrible infection. And if there were no pharma, I wouldn't be here like talking to you.
Yeah.
So they have like very nice things, but we need to understand we're immersed in economy that they want to sell us. And if they sell you, who's going to sell, for example, like go exercise, eat well? Nobody, because nobody's going to win. But if they sell you
Go
like
to track equipment, they'll do it. They win.
Yeah, that's true. That's true.
Or the Bowflex, right?
Yeah, but you know, like they simplify things for you as a consumer, not as a patient. So I think that's a misconception, and we have to be aware that pharmas and all the companies are to sell. Of course, they have like a very interesting tools, but the main thing is to sell. That's why they simplify things to sell them better.
What would you say to people listening right now to avoid being a consumer of these companies that just want to sell you and actually taking actionable steps to heal themselves?
I love that question, and I'm happy that you bring me. I'm not, and I told, for example, to my patients when they have pain because they have to take something, before swallowing the pill, just make a little bit of the space to listen, to feel the pain that your body's telling you. Because in that moment, a very small moment, you're going to realize a lot of things. Just take a little bit, feel your body, and then take the pill. I think that's the first thing, to start making awareness of our body. And for me, that's the first step. And I had saw like a lot of people that say, doctor, sometimes I was about to take the pill, then I listened to my body, and then I didn't feel the pain. So I let the pill. So I think that's the first step.
Yeah. Well, thank you so much for sitting down with me today. I appreciate this conversation.
It's a pleasure. It's a pleasure. Thank you.
Thank you so much for joining the conversation. If you could like, subscribe, or leave a review, it helps me so much in getting this information out to everyone who needs it. If you enjoyed this conversation, then I definitely want you to check out this.